Hi, welcome to the video presentation on dental implants, brought to you by dentalimplants.com. Unlike other methods of replacing a missing tooth, the dental implant is by far the best long-term solution. This is because while dental care has improved drastically in recent years, millions of Americans are still suffering from tooth loss. There are dozens of reasons that can cause teeth to die prematurely, but the most common include tooth decay, gum disease such as gingivitis or periodontitis, or high-impact injuries which cause the tooth to fall out. In addition to this, those who smoke, have diabetes, high blood pressure, and rheumatoid arthritis are also at an increased risk of losing teeth early. It was previously thought that if you lost a tooth due to any of these reasons, you simply had to go without, wear poorly fitting dentures or bridges to damage surrounding teeth. However, thanks to the dental implant, all of these has changed. What is a dental implant? A dental implant is an artificial tooth root that holds a prosthetic tooth in place. Unlike dentures, the tooth doesn't require any special denture creams, pastes, or glues to stay in place. Because it's an artificial root rather than just a tooth, it also doesn't require the support of neighboring teeth the way a crown does. This makes dental implants ideal for those who are missing multiple teeth or those who simply don't want to damage additional teeth in order to replace one. Dental implanting works by taking a titanium post and inserting it under the gum, or more commonly, deep within the jawbone. The bone accepts and osseointegrates with the titanium rod, merging into the bone in a similar manner as to how a natural tooth root is enclosed within the bone. Once the bone is completely fused with the titanium, an artificial tooth can be secured into the rod. Because the rod is implanted within the gum or bone, it is virtually impossible to come out. This means that the prosthetic tooth is much more secure than if dentures or bridges were being used instead. There are three types of dental implants: endosteel, subperosteel, and transosteel. Endosteel implants are most common. During endosteel implants, the gum is opened up, then a hole is drilled within the bone. Titanium screws and cylinders are then inserted within the jawbone. Once the bone has healed, the teeth can be secured in place. Subperosteel implants are less commonly done. During this implant, the screws are placed on top of the bone but under the gum line. This method is typically only used for patients who have minimal bone height and are unable or unwilling to wear dentures. Transosteel implants are used even less than subperosteel implants. This method involves drilling completely through the lower jaw, then bolting a metal plate into the bottom of the mouth. The titanium then goes through the bone. However, the failure rate for this form of implant is incredibly high. This method also requires opening the skin under the chin, resulting in scarring around the neck area and unnecessary recovery time. This, paired with a high failure rate, has caused most dentists to no longer attempt transosteel implants. Types of teeth implants. Just as there are several types of dental implants, there are also two types of artificial teeth that can be selected: removable or fixed implants. With a removable implant, the rod itself is not removable, but the tooth that screws into the rod is. This form of prosthesis includes an artificial white tooth with a plastic pink gum to appear realistic. The tooth snaps into the metal rod and is typically removed at night. There are several pros and cons to this implant, including more affordable than a fixed tooth, easy to remove for repairs, can cover a wider area for multiple missing teeth for a lower cost. A fixed implant is an artificial tooth that stays in place all the time, either due to permanently being screwed into the metal rod or because the implant has been cemented in place. Pros and cons of this implant include more secure than removable implants, can be cleaned and treated like normal teeth, much more expensive, therefore unable to use for multiple teeth unless price isn't a concern. During the procedure, because the dental implant typically merges with the bone, the surgical procedure must be done in steps. The entire process can take as little as 3 months to as many as 9, depending on the individual's situation. The first surgery will be to insert the titanium post within the bone or gum of the mouth. Patients will need to stay at the hospital overnight. However, the procedure is typically conducted at the hospital on an outpatient basis. The patient will be sedated and the doctor will cut open the gum in order to expose bone. Once exposed, holes are drilled in the area where the future tooth will be placed. A titanium cylinder is then placed within these holes, deep within the bone, just as a natural tooth growth would be. The gum is then stitched up so the cylinder is covered. Next, the patient must wait for the metal cylinder to osseointegrate with the bone. This typically takes between 2 to 6 months. Patients should also expect to follow a soft food diet for 7 to 10 days after their first surgery. Most dentists use dissolving stitches. However, if the stitches used within the gums are self-dissolving, the patient will need to visit the doctor to have them removed manually after about 2 weeks. After the first surgery, patients can expect to have swelling, bruising, pain, and minor bleeding around the gum area. Patients will be given pain medication to help make this bearable, and those who are prone to infection will be given antibiotics to help lower the risk of future complications occurring. After the bone is merged with the metal, the second surgery is done. During the surgery, the gum is reopened to expose the previously implanted metal rod, and abutment where the future tooth will be screwed in is then attached. The gum is then closed around but not over the abutment. For those who would rather not have 2 surgeries, the abutment can be placed within the gum during the first. Because the bone is still healing, however, the tooth or teeth can typically not be put in place yet. This means that the abutment will be visible for several months until fake tooth or teeth can be put into place. Many patients dislike these and opt for a second surgery to prevent the unsightly object being seen within their mouth. There are several advantages to dental implants, including high success rate of around 95%, feels and chews like real teeth, doesn't alter neighboring teeth, completely secure after healing, no creams or glues are needed, better for long-term oral health, looks identical to real teeth, can be used with one tooth or several, easy to care for. What is involved in getting a dental implant? Getting a dental implant isn't for everyone. Only patients who need a replacement tooth will benefit from the implant. For those looking to correct cosmetic problems such as having discolored or misshapen teeth, veneers are likely to be more practical. Typically, veneers cost much less than an implant because patients aren't actually getting a tooth to chew on, but rather a porcelain cover-up. Even those who are missing one or more teeth may not be a good candidate for dental implants. Ideally, a patient must be in good health, but generally speaking and orally. For example, those who have lost teeth due to gingivitis may not be eligible for dental implants. It is also highly recommended that patients be of adult age. This is because both children and teenagers still have their jaw bones growing. If an implant is placed too early, it can cause complications later on in life. If a child or teenager happens to be missing a tooth, whether from tooth decay or injury, they will likely be given a bridge until they become old enough to be a candidate for implants. Tooth implants cost can also be quite high as well, ranging from $1,300 to $3,000 per implant. This price can go up significantly depending on certain circumstances, however, such as where the tooth is being implanted. For example, if a tooth is being placed in the upper jaw, this may cost more than a tooth being placed in the lower jaw. This is because the sinus areas are affected, making surgery much more complicated. For those who have multiple teeth missing, the price of implants can rise to as much as $30,000. While this is a very large price to pay upfront, most patients end up spending less money overall since the implants are permanent and don't damage neighboring teeth. Despite this, the high price tag can still deter some patients. There are also many risks involved in receiving an implant. Some of these include infection at or around the implantation area, injuries to the surrounding teeth, nerve damage, pain, numbness or tingling feeling in the gums, mouth, chin or neck area, sinus problems, especially if the implants are being placed in the upper jaw. Because receiving a dental implant is so serious, patients must be sure to have both a doctor or periodontist working together to develop a care plan. Patients should also expect to have regular dental visits after the surgery to make sure the tooth implant and the bone are healing correctly. On average, 95% of dental implanting surgeries are successful. 5% failures are usually due to bone failing to fuse with the metal or patients practicing bad habits which can lead to complications resulting in a failure. The most commonly done bad habit is smoking. Patients should refrain from smoking tobacco for as long as possible after the surgery has been done. A dentist will be able to give patients an exact time frame depending on the amount of teeth that have been implanted, but as a general rule, the longer the better. If a patient must smoke, using an electronic cigarette is encouraged, as this prevents smoke from damaging the implant area. Patients should also refrain from chewing on hard items such as pens, pencils, ice, or hard candy. For those who have TMJ or other teeth grinding conditions, it's vital that proper treatment such as using a mouth guard is done daily. Patients should also expect to visit the dentist 6 months after the surgery has been done. This will allow the dentist to ensure that both the implant and bone are healing correctly. The dentist will also be able to check other teeth so future implanting due to teeth decay isn't needed. Finally, patients should expect to treat their new artificial teeth the same way as their natural teeth. These must be brushed or cleaned on a daily basis, and flossing is especially important to clean out the nooks and crannies around the metal abutments. Patients may also need to use a special toothbrush known as an interdental brush. This brush is able to slide through gaps more easily than a typical toothbrush, making it easier to clean the metal area of the implant. Due to the high success rate of dental implants, just about any healthy adult missing teeth would benefit from the procedure. However, those who would benefit most include individuals missing one or more teeth due to injuries or tooth decay. Any adult who is experiencing speech problems due to missing teeth. Individuals who have trouble eating or chewing due to lack of teeth. Patients who are unable or unwilling to wear dentures. Patients who would like to have tooth added without damaging neighboring teeth. Adults who are developing premature wrinkles or sunken in cheeks due to missing teeth. Patients who want an artificial tooth that lasts a lifetime as opposed to just a few years. Adults looking for a more permanent solution to partial denture. Patients who don't feel the dentures are secure when chewing. Adults who feel insecure about the smile due to missing teeth and are looking to get their confidence back. Because the dental implants is able to help a wide range of people, it's often recommended for those who have the time and money to invest in the procedure. Not only do the implants offer a long-term solution for tooth loss, but also the safest. Thank you for watching this video presentation on dental implants. For more details, please visit dentalimplants.costnow.com.